burns, injury, healing, and the fragility of the human body. Burns are among the most immediate and visceral forms of injury. They announce themselves with pain, visible damage, and a sudden awareness of how vulnerable the human body truly is. Whether caused by fire, heat, electricity, chemicals, or radiation, burns occupy a unique place in medicine and culture, sitting at the intersection of accident, technology, and survival. Medically, burns are classified by depth rather than size alone. Superficial burns affect only the outer layer of skin and are often painful but temporary. Deeper burns penetrate multiple layers, damaging nerves, blood vessels, and connective tissue. In the most severe cases, burns extend beyond the skin into muscle or bone. Paradoxically, these deepest injuries may cause less immediate pain, as nerve endings are destroyed. This absence of pain, however, signals greater danger rather than relief. The skin plays a crucial role in human survival. It regulates temperature, prevents infection, retains moisture, and acts as a sensory organ. When it is damaged, the body is exposed in ways that are not immediately visible. Severe burns disrupt fluid balance, weaken immune defense, and place enormous stress on internal systems. Historically, burn injuries were often fatal not because of the initial trauma, but due to infection and shock in the days that followed. The modern understanding of burn treatment represents one of medicine's quieter revolutions. Advances in wound care, sterilization, and skin grafting have dramatically improved survival rates. Burn units today are highly specialized environments, combining surgical expertise with long-term rehabilitation and psychological support. Recovery is rarely quick. Healing can take months or years, and the process often continues long after the skin appears closed. Burns also leave lasting marks beyond the physical. Scarring can restrict movement, alter appearance, and affect how individuals are perceived and how they perceive themselves. Psychological trauma is common, particularly when burns result from fires, explosions, or domestic accidents. Survivors may struggle with anxiety, social withdrawal, or a changed sense of identity. In this sense, burn injuries challenge the medical system not only to heal tissue, but to support the whole person. Culturally, fire has always been both a tool and a threat. It enabled cooking, warmth, and civilization itself, yet it remains one of the most destructive forces humans routinely encounter. Many burn injuries occur not through dramatic disasters, but through ordinary activities: cooking, heating, industrial work, or faulty technology. This ordinariness is what makes burns particularly unsettling. They reveal how thin the line is between daily life and serious harm. In recent decades, prevention has become as important as treatment. Improved safety standards, fire-resistant materials, public awareness campaigns, and workplace regulations have reduced burn-related deaths in many parts of the world. Still, burns remain a global health issue, especially in regions where open fires, unsafe housing, or limited medical access increase risk. Burns also raise ethical questions in extreme cases. Decisions about intensive treatment, quality of life, and long-term outcomes can be deeply complex. Medicine must balance the ability to save lives with respect for patient dignity and autonomy. Burns remind us of the body's dual nature, resilient yet fragile. Skin can regenerate, adapt, and heal, but it can also be overwhelmed in seconds. In confronting burns, medicine confronts urgency, uncertainty, and endurance all at once. More than just an injury, a burn is an event, one that interrupts normal life and forces a reckoning with vulnerability. The story of burns is therefore not only about damage, but about recovery, adaptation, and the remarkable capacity of the human body to repair itself after profound disruption.